If you're watching Skin Science, you've probably dealt with acne. But acne comes in many different forms. Those different forms can have an impact not only on your face, but on how well treatments work. Today, we're going to talk about the different types and categorizations of acne and how to treat them properly. Blackheads, whiteheads, papules, pustules, nodular cystic acne, oh my. Not a fun time, but you've probably had at least one of these. The question is, what are the differences, where do these come from, and how can I get them off of my frickin' face? There's much more to it than just whiteheads and blackheads, and as you can see from the common skin disorders poster here, things can get pretty complex up inside the layers of our skin. The main types of acne are whiteheads, blackheads, and cystic acne. But there are also things such as zits, pimples, breakouts, papules, and pustules. And we're going to talk about them all. First, let's talk about those whiteheads and blackheads. You might have heard of an open comedone or a closed comedone. These are the terms that are used in medicine, in medical school, and in the practicing medical field. These usually refer to whiteheads and blackheads, and the reason why is due to whether or not they are closed at the top. You're probably familiar with whiteheads, and they kind of look like little volcanoes because they're closed. This is considered a closed comedone. A blackhead has the same basic structure within the skin, has a lot of the same building blocks that a whitehead does, but the difference is that there's nothing sealing it over. There's not that little layer of skin on the top. Therefore, what's inside of the blackhead is exposed to the air. The oxygen oxidizes it, just the way a cut apple turns brown if you leave it out on the counter. And that process of oxidation turns the top of it black, therefore being a blackhead. Because it's open to the outside air, it is called an open comedone. Now, cystic acne by virtue is a closed comedone because it's under the skin. But unlike whiteheads, cystic acne is very hard to pop, and like whiteheads, you should not try to pop your cysts. It's also different because nodular cystic acne is much deeper inside of the skin, and depending on how severe it is, it can be very inflamed and even cause the appearance of tunneling throughout the skin as it damages other cell walls and other follicles. Ouch. I want you to remember that for all of these different types of acne, we have those four main building blocks. Do you remember the other Skin Science episode, and can you recall what they are? Oil, inflammation, a plug, and bacteria. So anyone who's suffering with acne is going to have all four of these components, but these do differ in the amount versus a blackhead, versus a whitehead, versus cystic acne, etc. And sometimes the causes of these different types of breakouts are different as well. Now, when we talk about whiteheads, we are also referring to pimples and zits. These are kind of lumped together. When it comes to breakouts, a breakout could be cystic acne, it could be whiteheads, or it could be blackheads. But when you think about it in a language sense, it's actually a verb. For example, I must break out of this dimension because I want to live in 4D space. Ooh, fancy. Different dimensions. That would be a fun series to do on this channel. And as with breaking out of your current life into another dimension, the word break out is a verb. It's what happens when someone's skin seems to be taken over by blackheads, whiteheads, or a combination of the two. But let's specifically talk about whiteheads first. Remember that whiteheads contain all four components of a breakout. But the thing with whiteheads is that they're normally white and there's normally pus inside of them. There's all of that white fluid that you should not pop, but it is oh so tempting to do. Usually, whiteheads have a little bit more inflammation, which is why they're also red on the outside. So even though they have all four building blocks of acne, it's usually the plug and the inflammation that are the worst components. Whiteheads can be caused by so many different things, but considering what happens to our skin, If we sweat too often or have improper hygiene, it can lead to a breakout of whiteheads. If we use products that aren't good for our skin or are irritating, that could lead to whiteheads. Or even certain medications or dietary intolerances can contribute to hormonal changes, which therefore show up as whiteheads on the skin. So how do you treat whiteheads? If we had a definitive answer, we would not be struggling, now would we? Because whiteheads do have this plug and they have a lot of inflammation, products that work to attack that are usually a good go. Benzoyl peroxide is an acne ingredient that has been used since the 1930s, and it's been proven over and over to work. Sometimes it can be a little bit drying, but it does a really good job at breaking down the top layers of skin, and it kills the acne bacteria in that whitehead as well. Salicylic acid is another ingredient you've probably heard of. It works by breaking up some of the oil, and it can actually help the skin exfoliate more naturally. So if you do have that plug, it helps to get rid of it. But sometimes people's skin doesn't respond to that. Retinoid creams, whether they are prescription retinoic acid or over-the-counter retinol or retinaldehyde, can also be really helpful. These can actually coat the inside of the pore, help to kill the acne bacteria and stop the plug from happening and stop your skin from producing as much oil. Or certain acids such as glycolic or lactic can go into the skin and help to create a little bit more turnover. There are also laser therapies, there are light therapies, and there are high-frequency machines, but those are usually a little bit more expensive and reserved for more severe cases. If you get a couple of whiteheads every now and again, try some spot treatments. Again, benzoyl peroxide, salicylic acid, or maybe even sulfur. But if things get a little bit worse, you might want to bring in some bigger treatments. We're going to talk about those when it comes to cystic acne. But first, let's talk about blackheads. Blackheads are usually oil related, and even though the skin doesn't fully exfoliate, it doesn't have that big plug on the top that sits on the top the way a whitehead does. Blackheads also have inflammation, but usually a very small amount, and it's also usually really deep in the skin. Most of the time the blackheads are not super inflamed. Now, what causes them? Usually it's oil related. There could be certain products that kind of give way to that, and if you sweat, specifically on your chest or your back, a lot of athletes tend to get blackheads in those areas. This could be a reason as well. When it comes to treating those blackheads, retinol and retinaldehyde are really great. If you're going prescription, you might be using a retinoic acid, such as Retin-A Micro or Tazorac cream. Or if you're looking for a synthetic, very gentle version of retinol, you might be using Differin or a Adapalene gel. Either way, these are all kind of in the same family, and they work by breaking down oil and by actually telling the skin to stop producing so much. They can really help with blackheads, and they can actually tighten the skin over time, meaning that the pores won't be as big, so they're not going to be as prone to collecting all that gunk. Blackheads are best treated by being removed by a professional, whether it's an esthetician or a dermatologist, because you don't want to do more damage to the skin. And I say this as someone who was a chronic picker and still picks every now and again. You really don't want to, because not only can you introduce infection and dirt and bacteria, but you can actually scar the skin. You can actually turn a blackhead into a whitehead if you're mixing all this stuff around, if you are causing physical damage and inflammation. So don't do it, but as someone who has been there, I also understand the lure. So I don't promote it, but please find a healthy way to extract them if that's what you feel you need to do. Using any of those AHA acids, those alpha hydroxy acids, such as glycolic, such as lactic, such as tartaric, such as malic acid, can also be really helpful. They can help to kind of loosen up the gunk and get it out of there, and then using something that is a non-clogging moisturizer, maybe with aloe vera or something soothing in it, can help to fill those in so that your sebum doesn't naturally pump out more stuff, and so it doesn't turn into a blackhead. But again, look at those lifestyle factors. If you play sports, if your skin is constantly rubbing and you sweat a lot and you get blackheads in those areas, try switching it up, or making sure that you bring a little towelette or something with you when you're on the soccer field or the tennis field court or those other fields that people play sports in, and like they throw balls and they catch them and stuff. Physical activity. I was obviously a science girl. When it comes to cysts, these are usually the most painful, and they're usually systemic or hormonal. This is the type of acne that I dealt with. And cysts are a little bit different because even though they're more similar to whiteheads, they are really based on inflammation, and they are so deep in the skin that a lot of times the external products we put on our skin don't always get to the root of the problem when it comes to treatment. Usually if someone has chronic systemic cystic acne, this shows that there is a hormonal imbalance, or perhaps there are other lifestyle factors that are contributing to that pain and to those cysts. This could be food and diet related, this could be stress related, this could be genetic, and the truth is that there are so many different variables when it comes to acne. If we had the answers, we wouldn't be here. There wouldn't be so much money going into research, and there wouldn't be 60 million people in America alone who are struggling with this. But cystic acne usually is the most painful, and it is characterized by a lot of that inflammation. Usually it's the bacteria and the inflammation that are doing the most. There is still oil involved and there is still a plug involved, but usually this is the systemic stuff. A lot of times it does happen here by the jawline, sometimes it can happen here on the forehead, and one of the worst cases of cystic acne is when it starts to tunnel. For instance, gravity or scratching or just pressure from sleeping on your pillow causes these cysts that are so sensitive and so inflamed to rupture. Meaning that inside the skin, what's normally in this follicle bursts and it actually spreads to other follicles, creating infections, pain, and damage there. This can continue down the skin and really create some of these painful nodules that are scarring, both physically and emotionally. Cystic acne, being so severe, usually needs some major treatment options. This is where the help from a dermatologist or from skincare professionals is really, really helpful. And especially if cystic acne or other acne is impacting your quality of life, your self-esteem, and your mental health, that's when you really want to consider doing something major about it, because that's no way to live. There are treatments for cystic acne, but most of the time things that you can get over the counter don't always penetrate deep enough. Retinol or retinaldehyde are a good place to start, but people with cystic acne will probably do better with something like retinoic acid, which is, again, that Tazorac or Retin-A micro cream. People with cystic acne might also need lasers. There are some injections that can help, and a lot of times doctors do prescribe medications, such as oral antibiotics, which might be prescribed for whiteheads, blackheads, or cysts, or Accutane, which is in the same family of retinol and retinal. It's that vitamin A family, and that is a very intense, but can also be a very life-changing medical drug. Cystic acne can also be improved with different hormonal changes. This could be hormone therapy, or it could be modifying your hormones based on fixing stress levels that might be out of whack, or fixing dietary changes, or insulin resistance that might be causing some sort of a reaction in a pathway that is leading to this. It's tough, and I'm not going to pretend it's not, because I've been there. But at the same time, there are options. There is information out there, and there are people dedicated to helping. So continue educating yourself and continue seeking out those options. And if you need somebody to talk to, speak up, because you won't be able to connect with others and help somebody else out or be helped by somebody else if we aren't vocal about it. And that goes for all forms of acne. I think the reason that acne is so damaging isn't because it's just there. It's because of the way it makes us feel. Acne is physical, but it's really emotional. If people didn't judge me for having acne, it wouldn't feel so freaking crappy all the time. And I feel that if we are able to break down that stigma, take hope into our lives, and kind of control into our own hands, we'll be able to deal with it a lot better. But for now, let's move on to papules and pustules. These are two different terms that are also used in the medical community, and they are not specific to acne or acne lesions. A papule is a small raised tender bump, so while it could be a whitehead, it could also be something like razor burn or even an insect bite. A pustule is a little bit different. These look a little bit more like blisters, and while again this could be related to acne, it also could be used in the generalization of any blister filled with pus. Fun. And I want you to remember that these three main types of acne, the whiteheads, the blackheads, and the cystic acne, can happen in varying degrees. They can happen together, they can happen separately, and they can happen in different places. The face, the back, and the chest are the most common, but you know, you've got skin all over your body and they can happen anywhere. There are also certain conditions that are related, such as rosacea, which is not indicative of having acne, but often they happen together. Or there are very extreme types of acne that include cystic acne and some of these other lesions. I could talk about this stuff forever. And there are other skin conditions that are related, such as the scars that are left behind, or post-inflammatory pigmentation or hyperpigmentation, the little red, white, or purple marks that are left behind. But we're going to be discussing those in future weeks. We only have 52 weeks in a year, once a week every Saturday for Skin Science, which is kind of a bummer. But if you want any deep dives on these, please let me know and I can do an extra bonus video. We will be discussing some of these other conditions such as scars and even pigmentation in the upcoming weeks, as well as some of the other treatment options and how to understand how benzoyl peroxide or retinaldehyde actually works. So be sure to use those motor neurons to tickle that like button and hit the subscribe and notification bell so you don't miss these things when they do come out. Even consider putting it on your calendar. Be like, hey Siri, or hey Bixby, remind me Saturdays at 11 a.m. that a new Skin Science is out there for me to get educated and empowered by. I love you guys so much. Always remember to be beautiful inside and out. Did you know that that's what this shirt said this entire time? Did you know that? Did anybody know that? And until next Saturday, remember to stay hydrated. I'll see you next week on Skin Science.